So, health behavior and education, understanding the factors that influence health behavior. So, it's basically part one of our lecture series, as this topic is a vast topic, so it cannot be covered in a single class, but I will try to cover it in two or three classes. So, today is our part one of this lecture series. So, we are going to discuss what is health behavior and what are different health behavior theories, and then we'll discuss how these theories change our perspectives and how people adopt new findings and new changes in their lifestyles. Introduction. So, health behavior refers to any action, habit, or lifestyle choice taken by individuals to maintain, improve, or restore their physical and mental well being. So, any action, habit, or lifestyle choice taken by individuals to maintain, improve, or restore their physical and mental well being. So, basically, it's a behavior that we adopt or that we learn and then we adopt and make part and parcel of our personality. For example, washing hands before eating any kind of meal, washing hands after using bathroom, and smoking cessation is another health behavior, and garbage collection in separate areas, etc., etc. So all of these are health behaviors that there are the actions, habits, or lifestyle choices taken by us to maintain, improve, or restore our physical and mental well-being. These intentional or unintentional behaviors include diet, physical activity, smoking, alcohol consumption, medical checkups as well. Medical checkups are also part of our health behavior, because when we get sick, if we do not go to the doctors, or if we do not go to the healers, the ailment increases in intensity. So, medical checkups, which can either promote or harm health. Key aspects of health behaviors include types. For example, actions can be proactive. Example given: uh, exercising, eating vegetables, eating salads, eating healthy diets, eating high fiber diets. So actions can be proactive or risky. So proactive actions are the positive actions, whether somebody is exercising, somebody is eating good fiber diet, somebody is eating healthy diets, how somebody is eating vegetables or salads, etc. Or these actions can be risky as well. For example, if someone is smoking or sedentary lifestyle or too much alcohol consumption, etc., etc., substance abuse, etc. So health behaviors are depending upon the types, and the examples are common examples include sleeping enough, practicing safe sex, following medical advice, and managing stress. Influences, for example, behaviors are often influenced by social, economic, and environmental factors and social determinants, and these actions directly impact mortality, morbidity, and overall quality of life. So learning objectives for today's class are, as my style is, I always start with the basic definitions. Then we will talk about various types of health behavior theories. Then we will discuss health impact pyramid, then health belief model, theory of planned behavior, trans-theoretical model of change, then social cognitive theory, and then diffusion of innovation. So these are the learning objectives. These are the things that we are going to discuss. First, we will talk about basic definitions. Then we will talk about what are health behavior theories. As I already told you guys, that this class we will talk about health behavior and health behavior theories. We will not talk about education and all the other things. We will talk about education, health behavior education, and then prevention strategies, etc., in our other classes, in our next classes. So health behavior theories are health impact pyramid and health belief model, health theory of planned behavior, trans-theoretical model of change, and social cognitive theory, and then diffusion of innovation. This diffusion of innovation is not a theory, it's basically a model where we discuss how people adapt new innovations in their lifestyle. So What is health? We have already discussed this definition in our previous lecture series as well, but as this is very, very important, so I could not miss it. Health is a state of complete physical, mental, and social well being of a person, and not merely the absence of disease or infirmity. Health behavior. Health behaviors refers to any action, habit, or lifestyle choice taken by individuals to maintain, improve, or restore their physical and mental well being. And what is a theory? A supposition or a system of ideas intended to explain something. For example, if we think that this process or this system works through a specific pathway, then when we theorize that specific pathway, then that is what forming a theory is. For example, if we make a theory, we do not know how it rains, and we make a theory that there are water vapors which are accumulating in the sky, and these water vapors are accumulating and forming clouds, and when these clouds go into specific areas where the water can be recondensed into rain droplets, and then their water droplets start pouring down and rain starts to happen. Now when we do not know this process, but we are theorizing that this might happen like that, then that is forming of theory, a system of idea about how it rains naturally. So a supposition or a system of ideas intended to explain something, for example, explain how it rains, that is a theory, especially one based on general principles independent of the thing to be explained. So now we're going to discuss health behavior theory. A health behavior theory is a conceptual framework that explains, predicts, and guides changes in health related actions by focusing on the relationship between personal beliefs, social context, and environmental factors. So health behavior theory is a framework, a conceptual framework that explains, predicts, and guides changes in health related actions by focusing on the relationship between personal beliefs, social context, and environmental factor. So basically, we theorize different health behaviors on the basis of some people's personal belief systems or their social belief systems or the environmental factors in which those people are residing in, and we theorize a health behavior model about all of those people. So this health behavior model then predicts that what people are doing and why they are doing. So it predicts and explains that why people are getting vaccinated, or if they're not getting vaccinated, or if they're refusing the vaccination of their children, then why are they refusing the vaccination of their children? Then there should be a theory about the people who are refusing the vaccination of their children, and we make a theory, and then we try to explain and predict the possible outcomes, and then we tell them that if your kids do not get vaccinated, what will happen, and if your kids do get vaccinated, what will happen. And based on all of these theories, we tell people what to do, especially being healthcare professionals. We know what is going on in people's mind when they're accepting a medical advancement or a medical treatment, or when they're refusing some medical advancement or medical treatment. A health model. A health model is a system or an approach used to interpret, understand, and investigate health, illness, and wellness, guiding how healthcare is delivered and perceived. These models, such as the biomedical or biopsychosocial, help identify the causes of diseases. So when we theorize a system, that is a theory. But when we make a system and we create a system, that becomes a model. So a health model is a system or an approach used to interpret, understand, and investigate health, illness, and wellness. So we make models out of theories, and then these models get implemented, and these models get implemented into various healthcare constructs. I know these things are a bit difficult to palate, these things are a bit difficult to understand, but it is what it is, so you have to understand the basics behind each and everything. I am trying to explain what a health behavior theory is and what is a health model in order for you people to understand what we're going to talk about in upcoming minutes, because what we are going to talk about is a very dry looking subject or a very difficult looking subject, so it is not easily palatable for every student. But when you understand the basics of what we're going to talk about, then you will be able to understand what these theories are and what these theories mean. So that is why I'm taking my time on these definitions, because if you do not understand these definitions well, then you will not be able to enjoy the class further. It is a dry topic, but still it is very, very important for all of the epidemiologists, for all of the public health managers, for all of the healthcare management people, for all of the people dealing in allied health sciences who have to deal with public health emergencies. So even if we do not like some subject because it seems dry or it seems difficult, still, if we are taught well, if we know the basics, at least we are able to understand that how these healthcare systems or how these health belief models are working. And that is why public health managers are very, very important in modern times. So, types of health behavior theories, there are three levels of theories. So, basically, theories of health behavior are at three levels. One is intrapersonal theory. So, one is intrapersonal theory, the theory related to myself. A theory within the self of some person is an intrapersonal theory. Intrapersonal theories are used more in psychiatry and psychology. The psychologists or psychiatrists used intrapersonal theories to define personality traits, to define different types of personality disorders, to define normal versus abnormal personality disorders. So basically, intrapersonal theories are used by psychologists or psychiatrists to theorize the different types of constructs, mental constructs of people, of behaviors of people, of people behaving specifically. And then these theories explain that why do people behave like that, or why do people behave like this. Then interpersonal theory are theories which are person to person theories about health beliefs, and these theories are related to the person to person interaction. For example, what do people think about the doctors in their community? What do people think about nurses in their community? What do people think about local healers in their communities? What do people think about some quacks in their communities? So these are person to person theories about health beliefs, that the on person to person level, what are the belief systems of people in a specific region. For example, in Africa, there are many people who believe in herbal medicine. Is same likewise in Europe, there are many people who believe in homeopathic medicine, and in Southeast Asia there are many people who again believe in herbal medicines and other forms of holistic medications, etc., etc. There are some people who are also believe in who also believe in chromotherapy, the therapy with color, the therapy with lights. So these are person to person theories about health beliefs, and these interpersonal theories explain how do these health belief systems work. And then there are community level theories. Community level theories are basically society level theories about health beliefs, but how a society thinks about specific set of sequences. For example, in Pakistan, sometimes people are very negative about surgical treatment of some fractures. For example, I am a trauma surgeon, I am an orthopedic surgeon, so I most of the times I encounter my patients who say, no, we do not want to go for this surgery of femur fracture or a tibia fracture. Some person told us, some relative told us that if you go for a surgery of femur fracture, then this bone will not heal at all, and we want to go to some local quack. He will apply some plaster bandage, or he will apply some bandage and we will get healed by that. We do not want to go for surgery, even if they need surgery, even if the surgery is go to thing for them. But if there is a society level belief that surgery is not a good thing, then people believe the society level theory about surgery not being a good thing for femur fracture, and they do not undergo for surgeries when they believe such things. So, what is a health impact pyramid? So, health impact pyramid is a five-tier framework introduced by Dr. Thomas Frieden, former director of the CDC America, to describe the effectiveness of different public health interventions. Its core principle is that interventions at the base of the pyramid have the greatest potential for the population-wide impact with the least individual effort required, whereas those at the top depend heavily on individual behavior change are generally less effective at at a large scale. So basically, this health impact pyramid states that the largest impact factor for people accepting healthy behaviors are the socioeconomic factors. So socioeconomic factors have the largest impact when we think about the susceptibility or perception of the people about healthy behaviors or health behaviors. So basically, these factors include poverty, education, housing inequality. For example, if a person is poor, then he even if he wants to undergo some good treatment or some ideal treatment for their children, he can't undergo that treatment for their children. Even if the person wants to undergo some expensive treatment for their children, they can't get it because they are poor. And similarly, if the patient is not educated at all, the patient will not understand the significance of treatments of for some specific disease. For example, there are belief systems in many parts of the world that cancer is incurable and there is no need to undergo any kind of surgery for cancer. There is no need to undergo chemotherapy for cancer. There is no need to undergo radiotherapy for cancer. You need not to treat cancer because patient is eventually gonna die. But in educated world, in Western world, it has known that there are many cancers which are being treated, and patients who are deemed unfit even to live 1 year have passed 10 years of their life without dying because of those successful treatments. So this is one example of a largest impact factor of socioeconomic factor. Then changing the context, for example, fluoridation, trans fat, smoke free laws, tobacco tax, etc. So these changing the context things also have a largest impact, relatively larger impact on the health behaviors. And then long lasting protective interventions are there, which also have a very good impact on the health behaviors of the people. As many the more people get vaccinated, the communicable diseases which are treatable with vaccination campaigns are decreasing in their numbers, and that is why these protective interventions are helping people not get infected with those communicable diseases. Then there are clinical interventions which may help some person, but which are not readily available to all of the populations. So that is why they have a very less impact factor on a societal level. And then counseling and education. Counseling and education works on individual level mostly. It works on individual level mostly. So counseling and education can be done person to person. It is not a thing that you fit all of the city in a single hall, or if you all of the city in a single stadium and you start educating them about something, they will not take your orders, they will not listen to you. So counseling and education works from person to person, works best from person to person. Now, another model is health belief model. So a health belief model is a psychological framework which was developed in 1950s to explain and predict health-related behaviors, particularly preventive actions and screenings. It posits that an individual's decision to adapt a healthy behavior is based on their perceived susceptibility to a disease, its severity, and benefits of action and potential barriers. So, health belief model. So what is health belief model? So it posits that an individual's decision to adopt a healthy behavior is based on their perceived susceptibility to a disease. If a person thinks that they can get this kind of disease or they can get hepatitis if they uh, take meals from uh, unhygienic food stalls without washing their hands and without taking care about who is preparing that food and the person who is preparing their food, whether he's uh, suffering from hepatitis or not. So what happens that that person starts thinking that I can get hepatitis if I start eating like that. For example, hepatitis A and hepatitis E, they spread through fecal-oral route. The person who is infected with hepatitis A virus or hepatitis E virus, they pass that virus in their stools. And if they do not wash their hands after defecating, and if they are especially involved in food business, so what do? They pass on their virus from their fingers to the all of the food items they are touching. What happens? All of the food items get infected with hepatitis A virus. Now, if people know that they can get hepatitis A or hepatitis E or any disease which can spread through fecal oral route, if they do not care about this aspect of food stalls, then that is called perceived susceptibility. So if a person has a perceived susceptibility to a disease, and then they know that how severe that disease can get, and then if they know that this severe disease can be prevented by this action of washing your hands, of not eating something from unhygienic stalls, and if they have potential barriers in their minds, then there is a belief that they start to act on. So, perceived susceptibility, perceived severity, and then health motivation, then perceived benefits of taking care of those aspects, and then perceived barriers that if they do get sick, what will happen to them, how will they get treated, how will they be admitted, whether they will be admitted in hospital or not, and then what happens that they get cues to action via this pathway. So they get cues to action by all of these things combined, and then they act. And then they act. They act by thinking that they can get this disease, and then they think that if they get this disease, that disease could be very severe, and that disease could damage their liver irreversibly. What will happen? That disease may damage their liver. Now, what when they start thinking about their liver and they get protective thoughts about protecting their liver, then there is health motivation. And then they start practicing health behaviors, that washing their hands, not eating from unhygienic stalls, etc., etc. Then these are the things which are being practiced because of the perceived benefits of washing their hands, perceived benefit from eating from hygienic places, and perceived barriers. Perceived barrier means that if they get sick, whether they will be treated ideally, whether they will be treated optimally or not. So all of these things combined give them a cue to action, that they should act. They should start taking care of this aspect, and then they act. And when they act, then the system of health belief model gets completed. Now that health belief model is has been created in all of the educated class, and they all of the healthy habits which are inculcated, for example, brushing your teeth, washing your hands, not smoking, not drinking heavily, etc., etc. So all of these health behaviors are based on this health belief model, and people's perceived susceptibilities and perceived severities of doing something bad compel them towards action, and then they take action to preserve their health. I hope you people understood. And then there is a theory of planned behavior. The theory of planned behavior, shortly called TPB, proposes that human behavior is driven by intentions which are shaped by three key factors. So human behavior is always driven by an intention. An intention means a will to do something. An intention means a thought process behind doing something. So our intentions are shaped by three key factors. Number one, attitudes. Whether we have a positive attitude about something or a negative attitude about something. Whether we think smoking is good or whether we think smoking is bad. Then subjective norms. Whether our society allows people to smoke freely, anywhere, everywhere, whenever, wherever they want, and perceived behavioral control. Whether the person who is thinking positive or negative about smoking has ease on smoking cessation, or is there difficulty in acting on it. It was developed by Isaac Asian. It predicts that stronger intentions and higher control increases the likelihood of performing a behavior. So, if you give the people the stronger intentions about something's positivity or negativity, for example, if you give someone this much positive intention about benefits of exercise, then the people start doing exercise. So if you give people positive intentions about benefits of exercise, then the people's intentions about exercise become more and more positive. And when they think and when they see many people doing regular exercise around them, they also think that, oh, we should also do exercise. And perceive behavior control whether they can stick on the routine of exercising regularly or not. So this theory of planned behavior explains how uh, people do what they do long term. For example, doing exercise daily for years and years and years, or at least 5 times a day for years and years and years, is not easy. You need impeccable discipline to achieve that kind of success with respect to that behavior of doing exercise. So, the theory of planned behavior tells how people do what they do long term. So, it predicts that stronger intentions and higher self control increases the likelihood of performing a behavior. That behavior can be positive, that behavior can be negative as well. So the context of TPB, attitude toward the behavior, an individual's positive or negative evaluation of performing the behavior. Subjective norms, the perceived social pressure from important others to engage or not engage in the behavior. Perceived behavioral control, the belief regarding how easy or difficult it will be to perform the behavior, which can directly predict behavior alongside intention. And then behavioral intention, the immediate conscious motivation or plan to perform the behavior, acting as a primary precursor to the action. So, if you have a behavioral intention in your mind, then you will start doing that positive thing. For example, if I have a behavioral intention in myself that I should do exercise, exercise is very important for my heart health, very important for my muscles, very important for my mental well being, very important for my sexual health, then that behavioral intentions will force me to perform that action. And that action will be start doing regular exercise. So, a theory of planned behavior continued as I already gave you an example of exercise. So, I have created this flow diagram. So, beliefs about the outcomes of the behavior. For example, if I exercise, I'll improve my health and lose some of my excess weight. Then, evaluation of the outcome will be being healthy and slimmer is enjoyable, satisfying, and pleasant for me. And normative beliefs about the behaviors, what other people think about the behavior. My family and friends think I should exercise, and then motivation to comply is I want to do what they want as well. First, I love to exercise, then my family and friends also want me to do exercise. So there are two behavior motivations. One is from within, and second is from person to person interaction. And this motivation to comply forces me to do what? Attitude to the specific behavior. So I conclude the exercise would be a good thing for me to do. If I start thinking positive, then what will we do? My attitude towards exercising will change. I will think exercise would be a good thing for me to do. And subjective norms are exercising is an appropriate thing to do. People also think that exercising is good. And perceived behavior control is I can resist the temptations not to go for exercise. So this is behavior control because when you have impeccable self control, when you have very good self control, when you have a very impeccable discipline in your life, then your perceived behavioral control is very good. The higher performing athletes have very good perceived behavioral control. If they think they will not drink, then they do not drink. If they think they will not smoke, they will not smoke, even if they are in a room full of smoking people. If they think they need to go to exercise, they will go to exercise for 5 times a week, or 6 times a week, or 4 times a week, whatever they decide. They will keep doing it. And they resist the temptations of not going for exercise. Behavioral intention is I'm going to start an exercise program from today. And behavior is I start doing exercise. So that's a theory of planned behavior. And this planned behavior is very, very important for self discipline. Then trans-theoretical model of change. There is also very, very important health behavior model. The trans-theoretical model of behavior change, often called the stage of change, the stages of change model, is a framework developed by Prochaska and De Clement that views change not as an event, but as a process occurring through various distinct stages, which are as follows. So what this model states, it states that change is not an event, it's a process. Change is not an event, it's not a single event that you stop smoking. No, it's not like that. If you have got this bad habit of smoking or heavy alcohol drinking, then there should be a model of change, and you should know that you are following that model in order to stop smoking forever or stop drinking alcohol, excess alcohol forever. So what De Clement stated, it stated that it is a process occurring through various distinct stages, which are as follows: pre-contemplation, contemplation, preparation, action, maintenance of that action, and then termination. What is pre-contemplation? Pre-contemplation means that patient is in a state of denial. The patient is smoking, but he still thinks that it's not a bad thing to do. I can keep smoking all my life. I can keep smoking and nothing bad will happen to me. So no recognition of need or interest in change. That is pre-contemplation. And then someone starts working with them, someone starts guiding them that you are damaging your lungs. You are damaging your lungs, you are damaging your brain, you are damaging your heart, you're damaging your blood vessels with this excess smoking. So then the person starts to contemplate. Person starts thinking, yeah, smoking is bad, smoking is bad, I should stop smoking, I should quit smoking. But still the person is contemplating. He is not serious about that. But then health professionals or family friends etc or his own self keep on forcing him that no, you need to stop smoking, you need to quit smoking. So what happens, they start preparing for change. Now the preparation phase comes. They have contemplated that smoking is bad, I should stop smoking, but they are still in a preparation phase. They are still not stopping smoking, but they're still in a preparation phase. So they're planning for change. So that is preparation phase. But what happens in their preparation phase, they start to think about action. They start thinking about action. They start thinking about, okay, I should stop smoking altogether, or at least I should reduce the number of cigarettes that I take. So what do? They halve their cigarettes, or they even quarter their cigarettes. And they used to take 20 cigarettes a day, and now they are taking 4 or 5 cigarettes, and they are increasing the intensity of this behavior. And gradually they stop smoking at all, and they come to 1 or 2 cigarettes per day, and within 15 days or within 30 days they have stopped smoking altogether. Now what happens, that they're very happy about it, that they have stopped smoking, they are very happy about it, that they are not smoking at all. And then one day they visit their friends, and all of the friends are smokers. So what happens, that now the real challenge has arrived. Now the real test has arrived. Whether they keep their promise to themselves that they will not smoke at all, or they go again back towards the preparation phase. Now that depends upon the person. If the person maintains their integrity, maintains their self discipline, and they do not smoke, then the person has entered the maintenance phase. That that cessation of smoking has been maintained by that person. That now that cessation of smoking has become an ongoing practice of healthy behavior. Now the person has entered the maintenance phase. Now they are not smoking even if they are in a room full of smoking people. So after the maintenance phase has been prolonged, and they have stopped smoking for like 6 months and 1 year, and now they do not have the urges to smoke, because when you stop smoking, you have transient urges to smoke. You have occasional urges to smoke, especially when you're depressed, especially when you are under anxiety, especially when you are stressed due to something. There are urges to smoke because smoking relieves your depression or stress, according to smokers, not according to me. But they say that whenever they smoke, their stress gets relieved, etc., etc. So they need to fight for 6 months to 1 year at least, and then they enter the termination phase. And what is termination phase? Termination phase means that now they do not need a special effort. Any kind of special effort is not needed by that person to stop smoking, stop themselves from smoking. And now they have surpassed the maintenance test. Now they are in termination phase. Their healthy behavior has become part of their personality, and now they will not smoke at all. Then there is another theory called social cognitive theory. The social cognitive theory, developed by Albert Bandura, posits that learning occurs in a social context through dynamic, reciprocal interactions among people. Personal cognitive factors, their behavior, and the environment. It emphasizes that individuals learn by observing others, not just through direct conditioning, highlighting key factors like observational learning, self efficacy, and reinforcement. So it's basically a social construct of health belief model. It states that people not only learn by reading themselves online, they not only learn by person to person education, but they also learn by observing other people. They also learn by observing what all of the society does, whether society is throwing trash into the dustbin or whether society is littering all around. So they learn by the social cognition of a behavior. So key components and mechanism of social cognitive theory, or SET, are reciprocal determinism. The core premise that personal factors, beliefs, cognition, environment, such as social context and behavior, operate as interacting determinants of each other. Your personal beliefs, the societal beliefs and behaviors, they all interact, and then you come with your own ideas. This is called reciprocal determinism. Then you determine what is good and what is wrong. You look at yourself, that what you want to do, you look at the society and what society is doing, then you reciprocate all of these things in your mind, and then you determine what is good thing to do, and then you do that thing. Then observational learning. It is called modeling. People learn behaviors, skills, attitudes by observing others, which is famously demonstrated in Bobo doll experiment. Then there is self-efficacy, and individuals believe in their capacity to execute behaviors necessary to produce specific performance attainments. It is a critical central construct influencing motivation and effort. Then outcome expectations are anticipated consequences of a behavior. Example given: social behavior, social approval, physical reward, which guides decision making. For example, if a person starts doing exercise, if a person starts doing workup, if a person starts with lifting weights, then they expect some outcomes. They want to hear good things about their body. If they are doing bodybuilding, or if they are doing calisthenics, or if they are doing athletics or gymnastics, they expect that society will accept this behavior in them, and society will reward them, or society will accept that they are good athletes, that they are society will appreciate that they are gymnasts, that they are good, their body shape is the body is in good shape, they are good bodybuilders, etc. So outcome expectations are also part of SCT. Then self-regulation, the ability to control one's behavior through self-monitoring, goal setting, and self-evaluation is also part and parcel of social cognitive theory. And then there is another model, and this is our last slide. And this slide states about diffusion of innovation. So diffusion of innovation theory developed by Everett Rogers explain how new health ideas, technologies, or behaviors spread through a community over time. It helps public health professionals understand that adoption of any new idea, adoption of any new innovation is not immediate, but follows a staged process: knowledge, persuasion, decision, implementation, and confirmation within a social system. The innovation, the new practice, example given, a new vaccine, a new application, or a new health policy, takes time to get accepted by general population. So adopter categories are there. The individuals are classified by their willingness to adopt. So there are 5 adopter categories. Number one are innovators. They are very less people. They are the risk takers. These are only 2.5% of the general population who take risks in adopting new things. Then there are early adopters. These are opinion leaders. These are visionaries. They adopt innovative things as early as possible. They are also very less. They also amount to around 14% of the general population. Then there is early majority. These are prudent adopters. So these prudent adopters adopt good innovations earlier than other population. Then there is late majority. These are skeptical people. They need social pressure to adopt new things. And then there are laggards. They are extremely traditional people. They are extremely conservative people. They are always resisting to change. They always want to live in their past, and they are very lost to adopt. So this is another diffusion of innovation model. In this model is based on technological advancement. So that is why it calls for 10%. Otherwise, innovators are only 2.5%. So these people are very willing to take risks and want to be the first to try the innovation. Then there are early adopters. They are around 15%. So these early adopters are visionaries. Then there are around early majority and late majority. The pragmatists, which are around 50%, then conservatives, which are around 15%, and then skeptics, which are around 10%. And these are also called laggards because they lag behind everyone. They are so skeptic of the change, they are so skeptic of the new things that they lag behind everyone in accepting new innovations or new changes. Have a nice day. Thank you. So we will go straight towards questions. I hope I tried to deliver what I wanted to deliver. I hope everyone liked it. It was a difficult topic, but uh, I think some of you at least understood these theories as I kept giving examples.
I do not see any questions yet. Anybody have a question? You can raise your hand or write it into chat. There's a
If there
comment.
is no question,
Eddie loved it.
if there is no question, if there is no question, either all of the people understood or either nobody understood. I don't know what's the case, but I
Yeah, it's
think
like
people did understand.
questions are to dive deeper into the ideas, to understand
Yeah.
better. Is there something, was it all too plain and clear? Was it too obvious? Sabina, we have a question from Sabina.
Oh, okay, okay, okay. Finally.
Hello. First of all, thank you so much for this great presentation. Oh my goodness, what happened? Am I still there?
Yes, we can hear you.
Okay, my
Yeah, yeah,
screen
yeah, yeah.
disappeared.
Yeah, we can hear you.
Sorry,
We
my
can hear
screen
you. We can hear
disappeared
you.
for
Go
a
ahead.
while. Okay. Yes, this is a great
Go ahead.
presentation. I was wondering what type of presentation is going to be. And I think it's a great one because it's talking about our life, how we connect our life with health issues, especially the issue of smoking, which really I am really concerned about because most of our young people, even from age 10, children, are all smoking and smoking cannabis and vapes, and it's everywhere. I wonder what type of society we are going to have or
Yeah,
which
yeah,
generation we're going to have in the future.
yeah,
The governments have to do something to put an end to this. And it's also highlighting the issue of how you maintain your habit. Even though you are somewhere, you still have to stick to your decision not to get attracted because of friends. And because it's the friends that really influence everybody else. And people are
yeah.
influenced on their way
Everybody.
to school and away from school. That's where all the influence happen. And the schools really,
Mm.
because the time children spend in school is more than what they spend with parents. I think we need to start putting this into the syllabuses, and this should be a great topic to be offered, everywhere, universities, and go ahead, offer it everywhere, worldwide, in schools, like open lectures people can attend and debate about it. It may help to reform people. I really am so happy about it. Hopefully, I'll be able to follow all the coming sessions. Thank you so much.
Yeah,
It's an eye
so
opener.
basically, so it is a dry topic on surface, but if
Mhm.
you really are a public health guy or a public health person, then you start understanding the importance of these dry topics because on surface they are dry. No people wants to talk about these dry topics. No people wants to talk about these non-palatable topics, but basically these are the basics of how health belief systems work. How we as health manager, I am a doctor, I we whenever we are dealing with patients behaviors, we are understanding the mentality behind what people are saying, because being health professionals, we have to read these things as well. Behavioral sciences is part of our curriculum, so we know what people behave and why do they behave like that. So we know how what projection is, we know what denial is, we know what uh, acceptance is, but we do not understand. What we do not understand is we do not study these health belief models in details. So these health belief models need to be understood in order for us to make younger generation understand about themselves. The self awareness does not come without these stages, without understanding of how healthy behaviors get inculcated into one's self. So we have to understand these behaviors as health professionals, or as people related with public health, or as allied health professionals, or as nurses, as doctors, or as anyone related with healthcare related fields. We need to understand these health belief models in order for the general population to accept these innovations, because we we have to make them understand that these healthy behaviors are a process. They are not just an act. There are stages behind what we are doing. Even if we do not know that our mind is working in so mysterious ways, that what we do not even know what we are doing, why we are doing. But these health belief models make us understand what we are doing, why we are doing, why do we accept that change in us. So this is why these theories and these models, they are not just a waste of time. They are very important for self-awareness. And this self-awareness then helps the younger generation adopt healthy behaviors and cessate unhealthy behaviors. Thank you.
I don't see any other more questions, but I have a question.
Okay, sir. Go
The
ahead.
the Tibetans in their medicine, through the centuries, the Tibetans said that everything is either a medicine or a poison, depending on how much you take. What do you think?
I
So,
think
like if you drink
you're
alcohol, a little bit of alcohol
okay.
relaxes you, but a lot of alcohol will actually do harm to you.
Yeah, there
And
is a
maybe
theory.
even snake venom, a
It
little
is a
bit of
theory.
snake venom could make you stronger and improve your immune system, but a lot of venom could overwhelm your body and cause harm. What do you think?
Yeah, it's not a theory. It's basics. It's basic science. Poison is not something which is outright poisonous. It is the dose that decides what a poison is. Even if you take sugar in excess amounts, that sugar is poison for you. Sugar is a harmless thing if you take 1 spoon, but if you take 100 spoons of sugar at a single time, now that sugar has become poison for you. Similarly, table salt, sodium chloride. If you take a pinch of salt and pour it in your mouth, it's not poison. But if you take whole fist of salt and pour it in your mouth, holy cow, that is a poison for you. So the poison is dose dependent. Anything which exceeds the dose which can be uh, uh, are taken by your body easily and without any harm, that is not poison. But if that need or if that excess is given to your body and that thing starts harming yourself, that is a poison. Similar is the case with drinking as well. There are many theories that taking 1 pint of alcohol per week is healthy, but if you start taking too much alcohol, that is not healthy. Even in some people also advocate that some form of smoking is healthy, although now it's a universally accepted deal that smoking in any form is not healthy. But there were people who used to advocate that smoking helps you um, relieve your constipation, etc., etc. So basically they used to say such things, but it was not like that. It was basically based on the activation of immune system and nicotinic adrenergic system, which used to relieve the constipation of the people who were smoking. But it was not the benefit of the smoking. It was the hijacking of our immune system, of our autonomic system. Sorry, immune system, I was saying autonomic system. It was a hijacking of the autonomic system by the dependence of the smoking. So our autonomic system needed a push from cigarette smoke in order for us to defecate. So people started thinking that we can only defecate when we smoke, otherwise we can't even defecate. So it was not like that. It was basically the hijacking of our autonomic system. Otherwise, this theory is plausible and this theory is being practiced all around the world. And I think this theory works. Poison is all depending upon the dose. It's not some related to the substance. Even sugar can be poison too if you take it too much. So I agree. I agree. So there is another question.
Do you see
What
that?
should I do to make someone denial changes his or her negative behavior? I can't understand the grammar.
So the person is
So
in
I
denial. They need to change their
okay.
negative behavior, but they're denying that it's a negative behavior.
They need counseling. they need counseling. There is no other thing than counseling. Patient needs counseling. They need proper counseling from psychologists. Because if a person is in denial, that is the most worst form of thing, and the person needs proper counseling in order to understand that they are in denial. Because when a person is in denial, the most difficult task for you to make them believe is that they are in denial, because they don't even believe that they're in denial. And denial is that is why denial is very, very dangerous. Because the person thinks everything is okay. There is nothing wrong with me doing something. There is nothing wrong with me at all. Whatever I'm doing is right, or whatever. The fact is, the patient is not even accepting the fact. So they need proper counseling. Without proper counseling, they will not change. Thank you.
Dr. Omer, do you think vitamins can be taken too much and become a poison?
Yeah,
Because I've heard that like you can take as much vitamin C as you want and it will never hurt your body. Is that true?
it's not like, no, it's not like that. Excess of everything is bad. Our forefathers have said that. And whatever they said, it was for a reason. They said excess of everything is bad. Whenever you do not need something for your body and you are taking it, you are dumping it in your body, it becomes a poison. Your liver has to process it. So the first victim of any excess that you take becomes your liver. All of the alcoholics have their liver failed. Alcoholic liver disease. There are millions of people who have died just because they thought alcohol is very healthy for them. And what happened? Their liver had to metabolize that alcohol, and all of them died because of liver failure, because of excessive drinking.
What do you
So
think
it's
about
just like that. You
people?
can't dump vitamins in your body.
What do you think about people who live in an area where there's only like one or two food sources that they can eat, whether it's like maybe rice? Can someone eat too much rice? Do you know what I mean? As one food?
It's a staple diet. They can eat rice for some days, they can eat rice for some period, but it's a staple diet. You can keep eating rice, but then there are consequences of eating something in excess,
Right.
because there are some vitamins which rice lacks, and they are present in barley, or they are present in wheat. And there are some things which are present in rice which are not present in barley or wheat. That is why there is a concept of balanced diet, because you do not give access to your body by eating one kind of food. There are fish eaters who only keep eating fish, 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 fish. What happens to them? They start having deficiency in all of the things that they could get from green vegetables, from the fresh fruits, etc. So they are deficient in all of those vitamins which we can get from eating fresh fruits and green vegetables. For example, folic acid, vitamin C, vitamin A, etc., etc. But they are very rich vitamin B12 levels, they are very rich vitamin D levels, but still they lack some of the vitamins, they lack some of the minerals which they could get from eating fresh fruits, fresh salads, etc. They are eating fish, apparently they are healthy, but they are lacking some of the vitamins. So that is why there is a concept of balanced diet. You can't eat one kind of food and keep thinking that, oh, I'm eating healthier type of food and it will not harm me. Eventually it will, because you are eating only one kind of food.
So you really need a diversity.
Yeah, you always need a diversity because we are omnivorous. We are made that way. We need a lot of vitamins and minerals. Then that is why we are omnivorous. Uh, God has created herbivores. They do not need they do not need to eat meat. All of the herbivores, goats, cows, etc., they do not need to eat meat. All of their needs get fulfilled by eating grasses or green leafy vegetables or greenery. They are made that way. We are not made that way. We need to eat greenery, vegetables, salads, as well as meat, poultry, eggs, milk, etc. We are omnivorous. We are made that way.
Okay, it looks like we've come to the end of our time. Um,
Yeah.
and it's just Musa's just asked the question about that you can change behavior with changing the theory model?
So these theories are not like how can I explain this? So basically, these theories are the basics of how health belief systems work. These theories are not directly applied in psychology. We're not talking about clinical psychology. We are not applying these theories directly to people. These theories are only the tip of the iceberg. These theories are the basics of how health belief systems work. These are not clinical psychology pearls. And this is not a textbook of psychology we're talking about. So these theories are the basics of how health belief models or health belief theories are made and how our health belief systems work. But in order to apply any theory to a patient, you need to become a classified psychologist.
Okay, I think that's going to do it. We could
I
probably
hope.
find some substances that even in low doses probably wouldn't be considered healthy. Like ether. Is
Yeah,
ether in a low dose healthy?
it's not.
It can't be healthy, can it?
You
Something.
can get some benefit from ether. You can get some benefit from ether because there are some medicines which are made from the substances derived from ether.
Right.
Yeah, there are people who are making medicine from ether. They are using ether's chemical traits for the benefit of us. But you can't
The
just take ether. Okay, I'm gonna drink ether for the benefit of my health. It's not like that.
the man who discovered ether had parties for ether. He would invite a lot of people and have parties where people would experience ether and be able to like release their emotions or their pent up feelings and let loose.
There are many let loose, but basically, there are many substances. There are many substances. People are using cocaine. People are using heroin for this. People are using fentanyl for this. But you can't justify evil because it makes you feel good. It's not like that. If you are
Because it
doing
does.
something bad, it is bad.
So even if you use those drugs in small amounts, you get that benefit, but it's damaging brain cells and nervous system cells.
Yeah, it is. It
There's
is.
really no
You
way to
start
take
using.
those safely.
No, there is no way. If a thing is highly addictive, there are substances which are deemed highly addictive. It is written on the label, highly addictive, not to be used without licensed physician's supervision. Why do they write such things? Because even if they are being used as a medicine, they need to be supervised when they are taken. Highly addictive things change your brain physically. They change your brain biochemically and they make you dependent upon those chemical substances and then they start damaging some parts of your brain.
All
That is why.
right. That's it. And we have a couple of questions, but we'll save for next time. Agustinho, I see that. How do you cope with narcissist friends? That's
No,
another issue.
it's not a relationship advice. I
Yeah.
can't I can't give you relationship advice here.
Okay, so that'll do it. Dr. Omer Farokhan, thank you so much.
We will
And this is
discuss
part one.
part two.
How many
Yeah.
courses do you have in this series?
I think I haven't really worked my way that how many classes I will have to take. Maybe two or three. I haven't
Perfect.
actually worked, but maybe two or three. Not that much long because it is a dry subject and people get bored of dry subjects as well.
No, it is fascinating. So yeah,
Yeah.
we want you back to keep talking about this subject. Okay, I'm going to
Yeah.
allow. Do you have anything more to say before we close?
No, it's fine. I have delivered all I wanted.
All right, then I'm going to allow everybody to unmute their microphones and to say thank you and bye.
Thank
You can,
you.
Thank you.
Thank you.
Thank you and bye.
Bye bye. Yeah.
Thank you.
thank you so much.
Thank you. Thank you. Thank you. Thank you. Thank you, everyone.
Be
Thank
healthy,
you.
everyone.
Thank you, everyone.
Be healthy.
Felicidades.
Thank you.
Thank you very much.
Thank
Dr.
you.
Gonzalez.
Thank
hello.
you.
Have a great day. Bye bye.
Thank you.
Thank you.
All
Thank
right.
you.
See everybody back again tomorrow for the next class. Bye-bye, everybody.
Right.